This module is on financing health care. Our healthcare system is complex and constantly changing. It is a mix of private and public initiatives and institutions that employ millions of workers in a variety of settings, providing a wide range of health services to a geographically and culturally diverse population. The United States has viewed healthcare as a commodity, readily available to those who can pay for it, but not universally available. Thus, some social programs have been adopted during times of great need. Social Security Act of 1935 was a result of the Great Depression. This resulted in Social Security payments, workmen's compensation, welfare assistance for the poor, and certain public health, maternal, and child health services. Independence Blue Cross and Blue Shield emerged as a private insurance plan to cover hospital and physician care, and this grew out of the Depression era. Medicare and Medicaid was created in 1965 through amendments to the Social Security Act. Impetus was concern for poor and older adults and the impact of catastrophic illness. Today, we have two main health entitlement programs, Medicare and Medicaid. These account for over 1/3 of the nation's total health spending. There is also the Veterans Administration health systems, the Indian Health Service, as well as private insurance and self-pay. The largest government insurance programs include Medicare, which funds health care for the elderly, disabled, and people receiving long-term treatment with dialysis. Medicaid, which funds health care for certain people who are living below the poverty line and also have disabilities. It is funded by both the state and the federal government. Medicare, on the other hand, covers the elderly over the age of 65 and those with certain disabilities. Medicare is federally funded and relies on taxes on wages for financing. Medicare is divided into 4 parts. Part A pays for inpatient hospitalization, home health, hospice, and skilled nursing. Part B pays for physician appointments and outpatient hospital services. Part C is the Medicare Advantage program, which expands beneficiary options for participation in private sector healthcare plans. And Part D helps pay prescription drugs not otherwise covered by Parts A and B. The Medicare donut hole, however, is part of a gap in the Medicare prescription drug plans. This means there's a temporary limit on what the drug plan will cover for drugs. Not everyone will enter the coverage gap. The coverage gap begins after you and your drug plan have spent a certain amount for covered drugs. In 2016, once you and your plan have spent $3,310 on covered drugs, you're now in the coverage gap. The Veterans Health Administration is a government-operated healthcare system providing comprehensive health services to eligible military veterans. About 8 million veterans are enrolled. The Indian Health Service provides health services to about 2 million American Indians and Alaskan Natives living on or near a reservation. This was authorized and funded by the Indian Sanitation Facilities and Services Act of 1959. A very important legislation, as American Indians have the worst health outcomes with a life expectancy that is lower than all Americans. It is common to evaluate the healthcare system on three dimensions: quality, access, and cost. Quality of care is the degree to which health services for individuals and populations increase the likelihood of desired outcomes and are consistent with current knowledge. Access is the ability to obtain needed, affordable, convenient, acceptable, and effective health care in a timely manner. The cost of health care is seen from the perspective of the consumer and the provider of goods and services. Most developed countries of the world have a health insurance system funded, subsidized, or managed by the national government. A great exception to this is the United States. According to the World Health Organization, the United States spent more on health care per capita, $10,000, and more on health care as a percentage of the gross domestic product, GDP, of 17.2% than any other nation. In fact, the national health expenditure is projected to hit $3.207 trillion this year. Personal costs have doubled every decade. The cost of health care does not necessarily translate into a healthier society. The U.S. ranks 34th in life expectancy when compared with like countries across all ages and incomes. This includes measures such as quality of care, access to care, equity, and healthy lives. Now let's spend a moment talking about health equity. Health equity does not equal health equality. Inequities differ also from disparities, which are differences in health status between people related to social or demographic areas as race, gender, income, or geographic region. Health disparities are one way we can measure our progress towards achieving health equity. In 2010, there were 50 million uninsured people in the United States, and the U.S. Census Bureau reported a decline in employer-based health insurance for the 11th year in a row. Now, that was in 2010. In an effort to address these issues, the Congress passed the Affordable Care Act in 2010, colloquially known as Obamacare. The law represents the most significant regulatory overhaul of the U.S. healthcare system since the passage of Medicare and Medicaid in 1965. Some aspects of the law were put into effect immediately, whereas other portions will take effect in the years to come, with full implementation expected by 2023. The Affordable Care Act was enacted to increase the quality and affordability of health insurance, lower the uninsured rate by expanding public and private insurance coverage, and reduce the cost of health care for individuals and the government. The law requires insurance companies to cover all applicants with new minimum standards and offer the same rates regardless of pre-existing conditions or gender. It introduced mechanisms like mandates, subsidies, and insurance exchanges. In March 2015, the Centers for Disease Control and Prevention reported that the average number of uninsured during the period from January to September 2014 was 11.4 million fewer than in 2010. A further significant drop in the number of uninsured was announced in 2016. The impact of the Affordable Care Act on nursing is seen through the efforts of the government to expand the healthcare workforce. The Affordable Care Act and the Institute of Medicine report calls for the modernization of the scope of practice for advanced practice nurses, APRNs, to facilitate their ability to be a major source of primary care services. Financially, this is being supported through expansion of the federal student loan program for schools and students focusing on primary care. This is the end of the program. Should you have any questions, please place them in the discussion board for course questions. Thank you.